There are good examples of health literacy practice all over Australia in innovation work, and the CEH, the example we have here, is just one fantastic example. But the problem is ad hoc, it's disconnected, it's difficult to find. And we really need to publish and disseminate health literacy findings, and we really need a national coordinated approach. And in America, they've had this for over 10 years, and we really need to keep lobbying to push that in Australia. And the Australian Commission on Safety, Quality and Healthcare have produced, I don't know if you've seen it, but they've produced this consultation paper, which they will be launching in, I think it's August this year, and it will be going to the Health Minister, trying to push forward a national approach, a national agenda to recognise health.
You've got any insights into the factor of acculturation on health literacy, between newly arrived immigrants, and then at what stage they become more health literate after arrival?
Oh, that's a great question, Margaret, and there are probably other people in the room who can probably know much more than I do about this area. I think the really important thing to be aware of in terms of count groups is to understand that there are different issues for culturally and linguistically diverse groups and, I guess, Australian-born or English-speaking Australians. Or I suppose there are different solutions to those two groups. In terms of your question about when in terms of acculturation, when people move to Australia and when they become able to become health literate, I don't think there's a single answer to that. I think there must be enormous variation depending on people's education levels and socioeconomic circumstances. But I think what we need to make sure we don't do is muddle the two groups, because there are different solutions for those two groups, and it's important to look at the impacts or how health literacy might impact health outcomes and what the solutions or what kinds of interventions we might need for those two groups separately.
But I'd like to get your opinion on how having a universal health system kind of influences health literacy in Australia.
Well, that's a great question. So I also have experience from living in Britain, which actually has a truly universal system. I would say Australia doesn't have a truly universal system. And I have experience not working in America, but doing a lot of work with Americans. And it's interesting because health literacy operates very differently, or interventions and approaches to health literacy operate differently in different countries exactly because of the health system. So in America, the focus has been, where the dominant amount of research has been on functional skills and intervening at the individual level, trying to improve things for the individual, changing materials, changing access, training healthcare providers. And they've done a lot of interesting work, but it's been absolutely at that individual level, and it's been very health dominated and health focused and sort of very narrowly focused, really, I would say. In Britain, because you have the National Health Service, if you want to make a change, you can implement it through health in one swoop. You really can. So you can change some patient materials, and there's one set for the whole country, and you are able to do that. And what I find in Australia is, we have a universal system in part. It's a very fragmented system. And so there is a very fragmented approach to providing patient information. And if, for instance, I wanted to produce one best guide on, for chronic kidney disease patients, we're doing some work in that area, it would be very difficult to implement that nationally, whereas you can do that in the UK. But I think Australia and the UK are similar in that we could take a national approach to improving, bringing in an adult education program to improve health literacy, or changing the national curriculum to incorporate health